Hi, cats. So I'm back with the Bipolar Disorder Survival Guide. And I wanted to read the section. It's called For Women Only, What You Need to Know About Bipolar Disorder and Your Health. So I'm going to skip to this part that says the course of bipolar disorder in women. And if you have the book, you can follow along. It's on page 257. So women have longer, more frequent, and more treatment-resistant depressions than men. So as a result, you are more likely to be misdiagnosed with recurrent major depressive disorder than a man would be. You may also have to wait several years longer before being treated for bipolar disorder. As an example, women are started on lithium an average of 5.5 years later than men. Alright, so since there are several factors going on, there's the fact that a lot of the depressive symptoms or the mixed episode symptoms are blamed on hormones and hormones alone. Bipolar can obviously amplify PMS quite a bit. Well, I mean, I say obviously, it's just a fact. Not everyone knows that fact, but it's true. And also, since women tend to have more depression, it's possible that they don't get diagnosed bipolar right away. And like it says, they don't get put on lithium for 5.5 years longer than men, which means that they're presumed to be unipolar depressive. So mixed episodes, rapid cycling, and bipolar 2 disorder are more common in women. Alright, which implies that bipolar 1 is statistically more common in men. And these conditions are often treated with complex combinations of medications, for example, mood stabilizers with accompanying typical antipsychotics that can pose particular health risks for you, for example, weight gain. I'm sure olanzapine and Zyprexa, is that the same thing? Well, users of those, like Seroquel types of drugs, can attest to that. So women have more manic or hypomanic episodes brought on by antidepressants. Now that's me. That's how I discovered I had bipolar. I was diagnosed with depression and was prescribed antidepressants, which brought on a full manic episode. Because you're more prone to depression, your doctor is more likely to prescribe an antidepressant without an accompanying mood stabilizer, which can trigger manic, mixed, or hypomanic episodes. So I think now, I mean, I was diagnosed way back in the early to mid 90s, and they didn't think to routinely give the patient a mood stabilizer. I think now they're a little bit more, they have more of a clue. Women are more likely to have physical disorders and pain conditions than men, so migraine headaches, thyroid disorders, and other problems can complicate both your medication regimen and your daily life. For women, mood medications are more likely to cause weight gain, insulin resistance, and elevations in blood lipids, complicating your quality of life and affecting your well-being. Well, that's something I did not know. I mean, obviously I know there are hormonal differences and that affects weight differently and metabolism, but so I guess it makes sense that women would be more affected by some of these neuroleptics or atypical antipsychotics. The disorder itself, not just the treatments for it, can affect women's functioning during pregnancy and the postpartum period, as well as the regularity of the menstrual cycle. Bipolar disorder is also associated with weight and insulin-related disorders like diabetes, polycystic ovarian syndrome, and menstrually related mood changes. So women with bipolar disorder are at risk, very high risk for postpartum depression. And then women are more likely to ruminate when depressed, whereas men are more likely to become aggressive or irritable. Women are more likely than men to have anxiety, panic attacks, body image problems, and eating disorders. These comorbid conditions often require separate medications or help through psychoeducation, mutual support groups, or psychotherapy. So this was written back when we didn't know as much about men and eating disorders in 2011. So we've had, you know, what, 8 years to figure things out a little bit more and sort of parse out recognition. So when a man presents for treatment, the recognition of the fact that he may have an eating disorder might not have been there at that time, whereas it's becoming a little bit more, the doctors have more of a clue now. So some things have changed, but essentially, if you were born with a female body, you have all of these risks, and obviously if you were born with a male body, you don't have menstruation and pregnancy and all that to worry about, so to speak. Okay, thank you. Be back soon, probably. Bye. Meow.